student is committing suicide. So this is the gross image what I'm trying to give you, that why mental health and managing stress is so important, because we are losing precious lives due to depression and due to suicide. So among people who commit suicide, 90% of them will have some or other form of mental illness in the form of depression, anxiety, or substance abuse like alcohol or drugs abuse or something like this. So in stress, there are two types of stress. One is called distress, another is called eustress. So what is eustress and what is distress? Eustress is positive stress. For example, there is a housewarming ceremony, Graha Pravesha at your home, or there is a marriage in your family, or you're joining a new college, or you're giving your first lecture, or something like that. Probably there might be some kind of an anxiety or a stress associated with it, isn't it? First time we are going to see some place, or we are driving to a different place, or meeting some higher authority or somebody, you will have some kind of natural anxiety that you might feel a little bit jittery, your heart might start pounding a little bit, you might feel, what if I don't speak well or talk well, or I might not create a very good impression about myself. All these things will be running in your mind. So that is called eustress. So something positive is happening to you, but you still feel a bit nervous. So that is called eustress. So distress is something which is due to some negative events in the life. So if you take according to psychiatry stress scale, which is the most stressful thing for a person, for a human being, is losing a life partner, a loving life partner who have lived with them together for more than a decade or so, and they have very good understanding with each other. They can't live with each other, and suddenly a partner dies. That leads to a severe amount of stress. Other things are like failures in exams, not getting a job, or financial difficulties, or getting cheated financially or through emotionally. These are all will lead to stress. Other things, probably financial distresses, as I told, like many agriculturists will commit suicide due to they are unable to repay the loans, or they have made some more commitments than they could have afforded. So all these things will lead to stress. So what stress does to our body? So stress causes changes in your physical part of your body as well as mental part of your body. So usually we're all now sitting in the, probably I'm sitting in my chamber, and you're all sitting in front of your mobiles or computers in your cozy rooms, I believe, or in the college. So we're all comfortable listening to each other now. And suddenly next to me, if a snake comes, and I get panic, isn't it? I suddenly feel there's a danger to my life. I need to rush away from this place, run away from this place, right? So how this trigger changes? If I were to sort of like get up from my chair and go out of my room, naturally I would take probably 5 to 10 seconds. But if a snake is there in front of me, or if suddenly if there is a fire next to me, probably within a fraction of a second I'm out. So how does it happen? So there is something called intrinsic change which happens in our body. This is called, whenever there is a stressful factor, three kinds of response is evoked in our body. One is flight response, you run away from the danger. The another is freeze response. You don't know what to do. You're just nervous. You can't imagine what is the solution for the problem, and you don't know how to react. You become frozen. So that is the freeze response. The third response is the fight response. That is a natural response which needs to come across. So flight response, fight response, as well as freeze response, right? So these three response. How it happens in the body, there's a lot of neurochemical changes in our body. So whenever there is a pertaining danger in front of you, the danger, which is very visible danger I gave you, there's a snake or a fire or something like that. There are a lot of invisible stress or danger, like failures in life, losing a life partner, loans, financial stress, or work-life balance, or getting backlashes from the management or from the students. Anything might happen, or you're getting stuck in the traffic. The various ranges of stress can happen. So whenever this happens, what happens in our body is there is something called a hormone called cortisol hormone. This cortisol hormone should be secreted only during the time of stress or an emergency situation. So when the cortisol hormone is released, it acts on our brain, right? So when it acts on the brain, it senses the danger. Your autonomic nervous system is triggered. Don't worry about the the terminology, I'll try to make it very simple. There is something called autonomic nervous system in our body which reacts to danger, right? So it when it sees the snake or fire, it reacts to danger so that your heart starts pumping, it starts palpitating. Usually a heart rate is 60 to 100. When you are in stress, your heart rate goes up to 120, 140, 150, like that. Actually, it is required. If your heart pumps more, the blood is circulated more to your muscles so that you can run away from the danger, right? So, and you will breathe more, you'll have hyperventilation, and you'll sweat more. All these things, changes will happen in your body, and some people might have churning sensation in the tummy, or they might have headache or something, spinning sensation in the head. So this is all required to make you alert and run away from the danger. So when there is a stress, but many of the stress, as I told, are not that visible as a snake or a fire or something. It's many times it's accumulated stress. You have a fight with your kid or your wife, and you come to college, you're going to teach to someone, you're read about it, and you want to disseminate the knowledge to the students, and some student is making fun of you, or is not giving a listening ears to you, and is trying to disturb the class. You suddenly burst out, right? You feel frustrated that in spite of my difficulties, I have prepared so much to teach to these students, and these students are not reciprocating to my hard work or effort. And you might feel really irritated, and you might suddenly start shouting at them, or you might really emotionally, you might outburst that, you might feel frustrated, the people are not responding to me. So this happens, the same thing, these kind of stress will trigger the same response. The cortisol is released and you'll have a panic attack. What is a panic attack? Suddenly your heartbeat goes fast and you'll have tremors. You'll start sweating more, you'll start ventilating, you'll start breathing more. Fast breathing will happen. And that will create a panic response, right? So many people get this kind of panic response to various other things as well. Some people, he just listening or hearing to someone is having a heart attack, or somebody met with an accident, somebody died with COVID-19, and various, dramatizing pictures are shown in the television or in the social media that this is how where they died and they were, cremated and all. Seeing those images and all, some people, it will trigger a panic response. So this changes will happen to your body. So when this cortisol is excessively released, it will act against insulin. Insulin is one more hormone in your body which controls your blood sugar. So that's why many diabetic patients, in spite of having a good diet control, in spite of having good physical activity and taking medications properly, they still have a stress response. You might have seen that many people who are athletics, fit people have heart attack. Recently, Ganguly had an heart attack. You might imagine that probably it's only the emotional stress which has led to that, because emotional stress can have that impact. That cortisol acts against insulin, it increases your blood sugar levels, and it also is causative factor for various disorders. It can increase your stress, can increase your blood pressure, your blood sugar, and your cholesterol levels. It can trigger an heart attack or a stroke or something like that. So it's very pertinent, very important to control the stress. So this is the emotional part of it that the stress can impact. The physical aspect, I told you, it can increase blood pressure, blood sugar, all these things. Stress can lead to depression, and it can lead to anxiety, and it can lead to severe kind of negative thoughts or suicidal thoughts. So what is depression? We need to understand that as well. So for example, you have a watch or you have a mobile phone with you, and if you lose it, will you be happy? I don't think so, isn't it? You'll be sad. You feel that somebody had gifted, or you felt that, I took this watch or a mobile out of my first salary, or some emotional link or attachment to that. So you definitely feel sad, right? So, but is sadness equivalent to depression? I don't think so. There is a difference between sadness and depression. Sadness is not a pervasive mood. Depression is when it's a clinical syndrome, when a person, after having a stress, is always dull in his mood, is not talking, not interacting, there's no smile on his face, and is not willing to go out with friends or family, is previously used to enjoy watching television or music, now he's not doing. So symptoms of depression are low mood, anhedonia, anergia. Low mode is always feeling low in yourselves, and that is pervasive. For example, if you lose watch or mobile, you might feel sad for a day, but you won't stop coming to college, teaching your students, or you won't stop eating or drinking or sleeping well, isn't it? But in depression, what happens is depression is pervasive, like continuous sad mood for more than 2 weeks. They'll be preoccupied with the loss. And anhedonias, loss of interest in previously pleasurable activities. Like previously, used to enjoy listening to some Kannada song or some old Kishore Kumar song or latest rap music or something. Now he's not interested in that, right? And energized, feeling very physically very tired for doing small things and going to a market or climbing the stairs, they'll feel tired. And loss of concentration, loss of appetite, like they won't feel like eating, their sleep will be disturbed, and negative thoughts will come. What are the negative thoughts? According to Martin Seligman, who is a father of cognitive therapy, he says it's a negative view about self, negative view about others, and negative about the future. This is the cognitive triad the depressed person will have in their mind. Right. So if the negative thoughts become more and more and more, some people might have suicidal thoughts. They might feel there's no point in living. Nobody cares about me. Nobody loves me. And whatever I do, my sacrifices or my helps or have gone in vain. I help people, but nobody helps me back. All these thoughts might run in your mind, and you might feel that there is no point in continuing. Let me take some tablets, or let me hang myself, or let me go away. And that's why, because the untreated depression will lead to suicides. So that is why mental health or looking after stress and depression is so important and so pertinent, right? And some people try to take refuge for stress and depression in substances. In a sense, some people might think that having a beer might reduce their stress, or having a smoke in between the in between the classes might reduce their stress, or having a pan or a gutka might probably reduce their stress, which I don't think which will reduce the stress. It will only add up to your stress. Mahatma Gandhiji once said that alcohol is not solution for any of your problems in life. It will only add one more problem to your life. So it might damage your kidneys or your liver or brain, all these things. So don't take refuge for your stress in alcohol or drugs or anything. People are starting taking cannabis and other things, thinking that they'll have a transient relaxation with cannabis or alcohol. They might feel a relaxation for a few minutes or a few hours. But the ultimate damage is a depressant, because alcohol reduces the certain neurochemicals in the brain, and you'll start feeling low in yourself, depressed in yourself, and it will ultimately lead to more depression rather than curing your depression. So don't take refuge for your depression or stress in alcohol. And what else? So anxiety and depression. Some people with stress very rarely can get a psychotic episode. They might start seeing things or hearing things which are not there. That is called schizophrenia. So these are all the range the stress can impact on our body. So the biology of it is the cortisol is released, acts on your brain, and your nervous system is triggered, and your blood pressure goes high, your blood sugar goes high, your heart will start pounding, and your ventilation will go up and down, and you might have a catastrophic thinking in your mind at that point in time of a panic attack. What is catastrophic thinking? Catastrophic thinking is extreme negative thinking. Stress can trigger that extreme negative thing. For example, I'm having a headache. The person might think I'm having a brain tumor, or they might have a little bit of pain over their chest. They might feel that, oh, I'm going to have a heart attack. I need to rush to a hospital. I need to get an ECG done, or let me check over the Google. What are the symptoms of heart attack? They will start doing this, So stress can trigger all these kind of responses. So how to sort of deal with stress? So let's focus the next few minutes on how to deal with stress, and later I'll be happy to take questions. So now during the Corona period, I think the whole lifestyle of the people has been changed, right? Uh, in last year, we had a routine that we used to get up at certain time, go for a walk or a jog or something, like do some yoga or something, then get ready to go to college, teach your students, take care of their research activities and report to the your HOD and do the all the curriculum based activities like assignments, exams, and reporting to VTU or reporting to the management about the activities. Everything was on track. And suddenly COVID came. It's taken everything out of gear. Right. It's all up and down. Many people like doing a webinar also. Probably nobody would have thought 2 years ago that we'll be sitting like this and doing this webinar on stress management. I would usually love to come to the JNNC and do a live session, more interactive session with more examples. But now here we are, right? So it has changed our lives. So it's all about adapting to the new norm. That is very much required. So I would like to say something about COVID, that people started, over indulging in listening to news or looking at their social media about how many people died, how many people were infected, how many were quarantined. Oh, I am having diabetes, I am having hypertension. What if I get COVID? If the college starts, students might not, follow the social distancing, or they might not use sanitizers properly, and I might get infected. All these things might be running in your minds, right? So first and foremost, what we have to understand that it is a viral infection, and the virus doesn't have any wings to fly and come near you. That we need to be very clear. What we need to understand is to keep yourself safe, is to wear a mask. Probably this is an N95 mask, right? So you need to wear it very properly. Majority of the times what happens is many people come to the hospitals, they'll keep their masks like this. The nose and the mouth is open, right? The mask should be snugly fit, right? Like this. Okay. So that is how somebody should use the mask. Majority of the times what happens is my relative comes near me or my friend comes near me and I lower down my mask. The usage of mask is you need to cover men. What is men? Mouth, eyes and nose. Avoid men, right? So because the virus can only transmit through the respiratory particles, or when you sneeze or when you cough. But if the person who is coughing is also wearing a mask and you are also wearing a mask and maintaining a 3 feet, minimum 3 to 6 feet distance, even if that person has COVID-19, you won't get COVID, right? So you need to be very clear on that. And you need to use hand sanitizers, and soap water is also very good, but you should not touch your fingers to your nose, mouth or eyes unnecessarily. Many people have that habit, they keep, touching their mouth or nose or eyes through their fingers. Don't do that. You go and wash your hands, then you can touch them. Unnecessarily, don't touch it. And one more thing is, be connected, but don't overload information. Many people are tracking the score of COVID. How many people died in India? How many people died in Pakistan or America or Japan or Britain or something like that? Don't keep track of it. It's not worth it, right? So because it will only increase your anxiety. Be aware of situation. Look at the news once in a day, but not like every half an hour you open your mobile and go to news website. Oh, this many people died. This happened, and vaccine. Some people took vaccine and some reaction happened. All these things. Don't be too much overindulgent in. Just follow the basics. And then I'll tell about stress management. That will probably also increase your immunity as well. So bring back routine or structure to life. So exercise, relax, communicate with family, online classes, adopt to the new lifestyle. And it's always it was previous dictum that it's always survival of the fittest. Now it's not the survival of the fittest. It's the survival of the person who can adapt to the new norm. So adaptation is the new norm. Adaptation is the new skill that one needs to develop to come out of this. So don't worry about profits, savings too much. It's more of year of survival in this period. So what can you do to reduce the stress in life? All right. So many people will give you various examples, weird things which comes in social media. or unscientific advices will be given to you. First and foremost, we have to be aware of our emotions and mind. That is very, very important, right? So there is a classic link between our thought, emotion, and behavior, right? For example, you walk across the corridor and you wish everybody good morning, and the opposite, your colleague probably doesn't wish you back, and he just walks away. What thought comes to your mind? Some people might think that the opposite person doesn't like me, he hates me, or nobody in the department or the college cares about me or loves me, that's why he just walked away. So that thought might come to your mind. If that kind of a thought comes to your mind, what will be the emotion? The emotion will be sadness or depression. What will be the behavior? If the same person walks to you after a few hours while going back to home, and you might just avoid that person, saying, this morning I wished he didn't respond, why should I go again and wish him? Isn't it? So this is called negative thinking pattern, right? There is something called positive thinking pattern, which can be the same situation can be dealt in a different way. If the opposite person doesn't wish you when you wish them in the morning, you might feel that a positive person who is confident about himself might think that I have not done anything wrong to anybody. I know what I am. I'm good to myself and to my colleagues and to my staff. Maybe the opposite person is absent minded, or he might be in some kind of a trouble that he didn't actually recognize me, or he might be deliberately doing this. I don't care about it, or I should not too much worry about it. So this is the thought which comes to your mind, that the thought is of more of self-confidence. You know yourself better than you being judged by somebody else's response to you, right? So that is the characteristics of a positive person, right? So that thought will be there, that will increase your self-confidence. So what will be the emotion? Emotion will not be depression. It will be happy mood, right? The behavior is that next time when the same person comes near you, you might again approach the same person and say, hey, this morning I wished you good morning. You didn't react. You just went away. Probably, are you okay? So you just try to build bridges with the person, or you might ask that person, come, let's go for a coffee or something like that. So you reconnect with the people. So this is how the mind is so crucial, so important. How you think matters more than anything else in the world, because it's all over mind over body, we say. The thinking makes man great, right? So how you analyze the situation is more important. If you feel that something is really worrying you, bothering you, talk to your near and dear. Ventilate your emotions to reduce the stress. Because many times, ventilating certain bad situations or some insult or some criticism to your family members or to a close confidant of your colleagues might relieve the stress. They might give some kind of like soothing words to you, boost your moral or confidence. Sometimes, majority of the times, what happens is many people don't ventilate their emotions. Why? Because this is probably a habit in certain colleges, schools, or some teams in MNCs as well. People are fearful or scared to express their failures or their insults or criticisms to their colleagues. Why? Because if I tell to this my colleague, she or he will go and tell everybody else. It's just like yesterday I told I fell from my bike to one colleague, and 2 days later everybody will be asking me, oh, where did you fall? Then I'll be surprised. I told to only one person, how come everybody is asking me about it? So this is where people lose trust, right? Many people come to a psychiatrist, to us, or psychologist. They ventilate their many emotions which they have not told to their own family members. Many kind of unresolved conflicts which had happened in their lives, they will express to us, because we always reassure them that whatever you tell to us is purely confidential. It will be only one-to-one. This information will not go away from the consultation chamber. Even my other staff will not come to know about it. You be open to me. So then is the confidence comes to the client or to the person who is in distress, and he expresses. When somebody expresses or ventilates, 50% of the tension is released then and there itself. So be a good friend to your colleagues. That is very, very important, that if somebody tells their sad story or their difficulties, if you can't help them financially or some other means, many times they won't be asking for financial help. It's all about connecting to them and giving that moral support and booster that I'm there for you, don't worry, whatever is possible from my side, I'll help you. Those few kind words will lift their somebody's mood. So that is very, very important. You need to express your mind. Don't keep it like a pressure cooker. Keep all the depressions, frustration, anger, all cooked up in the pressure cooker, and someday it will blast out, and you'll be in real depression, and you'll need a help of psychiatrists or medications or ECTs or other things where the depression goes to severe. Because I every day go to multi-specialty hospitals where I see minimum at least 5 to 10 people who have attempted suicide every day by hanging or taking medication. They're all professional people, they're all students and other people above middle class many times. Because it's all due to some conflict is there, they're unable to express to their family or their colleagues, and they pressure up and they explode. So that is the one crucial point, that you need to express yourself. The next thing is, whenever the difficult thought comes, you need to analyze your thought. Why am I getting irritated? Why am I depressed? What is that I want out of my life? What are my goals in my life? What is that I am achieved in my life? Or am I comparing myself to others too much? Because this will create a lot of stress and anxiety to people, because people tend to compare themselves to somebody else. Oh, somebody got a prize, somebody got an award, somebody was awarded a PhD. Oh, mine is not done. Or our HOD always praises the other colleague, or the management will always favor this person or that person. You always tend to sort of try to compare your life to somebody else's life. I'll tell you, never compare your life to anybody, because your struggle is different, your background is different from where you have come, and sometimes the good things will come little bit later to good people. I'll tell you a small story of a person who wanted to participate in Olympics, and first time he participated in Olympics in swimming, he couldn't win. He had practiced for years and years, and he couldn't win a bronze medal, and he was so frustrated and he became so depressed. He locked himself in the room and he was not speaking to anybody for almost a month. Then his friend took him to a psychiatrist, gave him counseling, and antidepressant medications were given. And then he restarted practicing. He started becoming so motivated that either he was found in the swimming pool or in the bed. That's it. Only two places. Go sleep or get practice in the swimming pool. That was the passion this person was having. In the next Olympics, he participated. Every event he participated got him a gold medal. Gold medal in 100, 200, 400, relay, everything. And this person is none other than Michael Phelps. Michael Phelps is the highest gold medal winner in the world, Olympic gold medal winner in the world. He went through depression, and his depression was treated by a psychiatrist and psychologist, and he took professional help for his depression, and now he is a mental health advocate. He is helping other people who are in depression. So that's why. So he could have compared to somebody else, saying that those people have got 2 or 3 gold medals, 5 gold medals. I couldn't even win 1 gold medal. And later on, he started his gold winning spree that he reached up to 28 gold medals. That's why your time will also come. You keep studying, keep doing your hard work, keep up the fight. Never give up, never lose hope in your heart and mind. That's how you should be. So always believe yourself. Somebody else's negative opinion should not become our reality. Somebody might say that you are good for nothing. Your communication is bad, the way you teach is bad, or you don't get along with students or with other colleagues is bad. If there is some truth in their criticism, try to change, try to improvise. But some people are so negative that they don't want others to prosper. They always pull somebody's leg. So be careful about those kind of negative people around you, and your answer should be, your action should speak louder than words. I'll give one more example about sledging. Many people would know about this. In cricket, what happens is, a bowler comes and bowls. After bowling, the bowler will come to the batsman and say, Next ball, I'm going to knock off your head. You stupid idiot, you come to play, international cricket. You don't know how to play even a gully cricket. You come here. So usually Australian bowlers do this to other, players. So some people, immature players like Sri Shant or Harbhajan Singh, would lift their bat and go and start physically fighting with that bowler. How dare you, tell me all this? Next ball you bowl, I'm going to hit a six, which will go out of the stadium. Exactly, this is what the bowler wants from the batsman, that you get irritated, you get frustrated, and you lose your concentration on your game. And the next ball is bowling, he wants to hit that big six, and he's out, right? Mature players, for example, like Sachin Tendulkar or Dhoni or Rahul Dravid, something like that, probably would not even look at the bowler who is, hurling abuses, who is irritating. He will just play his normal game. Whenever there's a loose ball, he will just take, four or something like that. And once they complete their 50 or 100, then they will lift their helmet and show the bat to that person, saying that if you irritate me, this is what I am capable of. So you answer through your actions. Your actions should speak louder than words. So your performance should speak rather than getting into a verbal duel or quarrel with your colleague or your seniors or something like that. So be confident about yourself. Never lose hope on yourself. And what are the preventive measures to reduce stress? The best thing is doing physical activity. I worked in UK for 5 years. I was in London as a psychiatrist. So there for every disease, there is something called guidelines, NICE guidelines, National Institute of Clinical Excellence guidelines, right? This guidelines for mild depression to mild anxiety, they say no medication, only physical activity. 1 hour of physical activity, if you do, like running, jogging, skipping, cycling, or a weird yoga postures of Baba Ramdev, whatever you fancy, you can do. At least 1 hour of physical activity, if you do, if your cardiorespiratory rate increases, there will be something called endorphins, which will be released in our body when you do physical activity. These endorphins will act on your brain. Those are all natural antidepressants, which will lift your mood and reduce your stress. So 1 hour of physical activity is a must to avoid stress as well as getting into depression. What else can you do? The another simple thing is deep breathing exercise. Deep breathing exercise appears very simple, but it's very effective. So I'll just try to demonstrate to you what is deep breathing exercise. Deep breathing exercise is trying to do what is opposite of being panic or being under stress. I told whenever I am in stress, my heartbeat goes fast and my breathing will also go fast, right? So we are trying to reverse that in deep breathing exercise. So what I'll do is I'll close my eyes, sit properly, and take a deep breath inside at the count of 7, like 1, 2, 3, 4, 5, 6, 7. At the count of 7, I take deep breath inside, then hold it for 4 seconds like that, and gradually release it in another 7 seconds. During this time, I'm only concentrating on my breathing and nothing else. My mind is empty at that time. I'll focus only on my breathing, how the air is coming through my nostrils and is filling my lungs. And again, how it's going out of my lungs through nostrils. That is the only thing I'll concentrate 100%. So if you do this 10 times in the morning, 10 times in the afternoon, and 10 times in the evening, it will reduce your stress levels. And it's scientifically proven. So that is a very simple technique you can do daily. And whenever you are in stress, you go to your chamber, have a glass of water, and do deep breathing for 5 to 10 times. You'll feel relaxed. Your BP will come down, your blood sugar will come down, your heart rate will normalize. So do it. And other things, what you can do is music. If somebody is interested in listening to music, various kind. Somebody might be interested in film music. Somebody might be interested in classical music or instrumental music. Whatever you enjoy. Don't worry about the world. that, oh, what he might think about my choices or my preferences. Don't worry about it. It's your life. You need to enjoy it. So whatever you like to de-stress or reduce tension, you can do it. Or some kind of indoor games within the college campus. You can play a little bit of games like table tennis or 10 minutes of shuttle badminton. You can devise your time so that at least 10-15 minutes of some physical activity in between or sports activity in between will help. And it will also increase your vitamin D and vitamin C levels in your body as well. All right. So apart from this, there is something called Jacobson progressive muscular relaxation is there. That needs to be taught. Actually, if I think a year, 2 years ago, we did a session in JNNC MBA auditorium. We did teach JPMR. This is called Jacobson progressive muscular relaxation. Probably in a webinar, it's very difficult to demonstrate that. So it can be taught in the hospital, or if somebody wants to get it done, it can be trained. So that is also scientifically proven that what we do is, like, before getting into that training, we check your blood pressure, your ECG, EEG, your pulse rate, oxygen saturation, and after going through the relaxation therapy, we again check and we see the significant difference in their heart rate, in their respiratory rate, as well as in their ECG and brain waves. So that is the importance of relaxation. So the next, probably the thing is to find purpose of life. Probably, what is happiness? For many people, it's all different. Somebody might be very passionate about achieving something academically. Somebody might be balancing their kids, their husband, and again coming to college and teaching, so that work-life balance, or coming out of from a lower middle class to a higher middle class to family, improving their standards of living financially or academically. That might be the reason, or achieving something. But in the process, we might also fail. So don't be afraid of failures in life. I'll say there's probably no one in this world who has not never met with a failure. Even APJ Abdul Kalam, probably he wanted to become an Air Force pilot like Abhinandan. He went to attend two interviews at the same time, one at the Ministry of Defense in New Delhi, another one in Dehradun, which was Air Force pilot interview. He wanted to become Air Force pilot, but he was rejected there. He couldn't get a job there. He got a job in the Ministry of Defense, and he utilized that opportunity so well. He became nuclear scientist, and he was so well respected. He became president and was the best president we still remember, isn't it? So sometimes life throws challenges, throws failures at us. We need to take it very sportively, that this is not the end of the world, or this is not the end of life, and this is a new beginning. So always have confidence about yourself, your work, your abilities, and try to improvise yourself. So all these things. In spite of doing all this, people can still get into depression out of stress, because depression is caused due to biopsychosocial reasons. Biological is their hereditary characteristics as well as neurochemical in the brain. Like how diabetes happens is due to deficiency of insulin. The same way depression happens due to deficiency of neurochemical called serotonin in the brain. Serotonin, norepinephrine, dopamine, acetylcholine, there are various neurochemicals. Main is the serotonin deficiency in the brain. Even somebody, their life is beautiful, everything is going on according to their plan, everything is perfect, but still they're low in themselves. They're feeling very unhappy about themselves, not eating, drinking well, and not sleeping well. They might still be depressed. So for them, I think, and other people, in spite of doing all these preventive measures and taking care of their mind, everything, and being away from toxic people and toxic substances like alcohol, drugs, or smoking, still somebody can get into depression. If they get into depression, don't be fearful to seek help from a psychiatrist or a psychologist. That is very important, because many times what happens, if I go to psychiatrist, they'll tell me mad, all these things will come to your mind, right? It's not like that, because depression is the second largest disease in the world according to WHO. You need to understand this. After heart disease, depression is second largest disease by 2020. By 2030, it's going to be the first largest disease in the world. So out of probably 10 people, 3 people are having depression. If you don't, like if I have a fall, if I break my bone, or if I have some wound, I go to a doctor immediately, take care of my health, right? But why don't I take care of my mind? if I have depression or anxiety, because many people, Abraham Lincoln went through depression, Deepika Padukone went through depression, Hrithik Roshan went through depression. There are many people. J.K. Rowling's Harry Potter author, when her, most of the novels were rejected, she went through depression. Michael Phillip went through depression. So numerous people, but they all sought help professionally to come out of depression. Depression can be treated through counseling is the basic, then is a cognitive therapy to change your negative thinking pattern to positive thinking pattern. The third is medication, antidepressant tablets, which will increase the serotonin levels in the brain. All these methods are there, which can be tailored according to your needs, right? So if you want to lead a stress-free life, first have a good vision for yourself, believe in yourself, avoid toxic people and toxic substances, never lose hope, don't be fearful of failures in life, take failures as challenges of life, and again your action should speak louder than your words, that failure is not fatal, success is not final, it's the courage that counts. So be courageous in life, and if you need that professional help, never hesitate to take professional help, because at the end of the day, many people, as I told, many people lose their life due to depression by committing suicide. Lifelong, their family members will suffer. Recently, one of my friend who is a Taluk medical officer in Nanjangud, due to a pressure from the administration, committed suicide. And we are all frustrated that he has just 7-year-old kid. We all students from the Jesus Medical College collected some funds and gave to the family, but that is only a small bit we can do. But the life cannot be bought back, isn't it? So never lose hope in your life, and never think of committing suicide or giving up life in life. There are solutions for problems. You need to unwind your potential and seek right professional help. And thank you so much. And if you have any questions, I'll be happy to take. Hello. Hello, Dr. Pramod.
Dear participant, I request you all to ask any sort of query. If you are having any sort of queries, please do ask questions. Arvind sir is open to take up your queries. So, sir, we have a question from Mohit.
Yeah. Negative vibes in life. Yeah. Ask few more questions so that I can answer in one go. Any other questions? You can type your questions. Or stress ball. Okay, next. Any other question? Be open. How to set mind in one direction thinking. How to avoid confusion in decision making. Wonderful, wonderful. Yes, let's keep it coming. How to be stress-free in profession even if nothing happening good. All right. Okay, now I'll take this. Fine. So somebody asked about how to avoid negative vibes. See, what we have to understand that life is not bed of roses, right? Even the rose has a thorn, isn't it? So we need to understand that we all want a beautiful life, right? Nobody wants stress, right? But stress is an inevitable part of life that we need to understand. Dukh hi sukh hai, probably Chanakya said it once. So what we need to understand that life will definitely throw challenges to you wherever you are in your lives, whether you are a student, whether you're a professor, whether you're a husband or a wife or a father, mother, some challenges will come across to your mind. So at that point in time, what we need to understand is we need to focus on the solutions rather than on the problem. Some people, what they do is they start brooding. Oh, all bad things happen to me only. And many people feel that, I'm more unlucky, than anybody else. I'm not very lucky. All these things will keep coming to you. This is called ants. That is called automatic negative thoughts will come to your mind. They might suddenly feel that I'm not a good professor, I'm not a good husband, I'm not a good wife, or not a good daughter or son, or something might creep into your mind. You need to evaluate that thought, whether the thought is negative thought or a positive thought. If the thought is negative, you don't need to accept it immediately. Many people, what they do is, thought comes to their mind, they immediately accept. Oh, I'm not a good professor, somebody told. Oh, I might be very bad, that's why nobody listens to me, something like this, isn't it? So but you need to critically analyze that thought. I have definitely done my best. I've prepared for my classes, I've given my best, I've read from various books and try to assimilate, summarize the knowledge to them. If somebody is taking it in a good spirit, it's well and good. Beyond that, I can't really force my knowledge into somebody's brain, isn't it? You can give, they say you can take the horse to the water, you can't make it drink, isn't it? So you can do your best and don't expect too much out of them, about the results or the reciprocation out of them. So they say that mind is a beautiful garden. If you want to raise a flower, you need to put some seeds, you need to water them, fertilize them, protect them. One day the beautiful flower will be there. But if you keep the site or that land very open and don't do anything, what will happen? Weeds will grow. Mind is like that. Ideal mind is devil's workshop. If you start ruminating about your past failures, comparing yourself to others, unnecessary things, your mind will be like that, devil's workshop. But if you want to create a positive thought, you need to learn from your failures, learn from your mistakes. There will be toxic people, negative vibes, all will be there. But you need to deal with them very effectively, saying that yes, they always say, isn't it? If you take example of Sachin Tendulkar, first time when he went to the cricket stadium, many people showed feeding bottles to him, saying that you are just 16-year-old bacha, go jaake doodh pi. Then one of the Wakar units ball hit his nose and he started bleeding. But he told, I'm not going to get retired at, I'm my khelega. He did it. And 3 matches he couldn't be successful. The fourth match, where was the exhibition match, he hit 49 runs and each consecutive 3 sixes out of Abdul Qadir's bowling. So there might be immense kind of these things like in your professional life as well. You might have not done well till now, but it doesn't mean that you won't be successful in the future. You can definitely be successful. Only you have, what you need to do is you need to do a SWOT analysis, your strength, weakness, opportunity, threat. Work on your weaknesses, improvise your skills, and then you can definitely come out of it. Somebody asked about stress balls. Are stress balls useful? Stress balls are okay. It is probably what we teach about Jacobson progressive muscular relaxation is alternate contraction and relaxation of muscles. Stress balls do that. For to a certain extent, it will do well. What I need to emphasize to all of you is, first is your mind, your thinking. Next is all this exercises and relaxation techniques, deep breathing, all these things. You need to mind your mind. What kind of thoughts you're getting? Positive, negative. If it is a negative thought, I should not accept that negative thought. I need to challenge that negative thought and prove to that I am worth it. So this is more crucial. And somebody told about, if nothing is good is happening in my academic life, why I should be happy? What we need to think is, we just forget that what God has given to us in life. I am speaking to you, my hands are moving, I'm seeing, I'm listening. This itself is a blessing from God that we need to understand, because there are many people who are blind, who are deaf, who are dumb, who don't have a life, who don't have houses, who are sleeping on streets. They don't have a square meal per day. And we think that we always crumble, always, be always, cranky that I didn't get my promotion, or I didn't get this, I didn't get that. And we always try to compare that. First, be, thankful to what you have. That is called attitude of gratitude. We need to develop that. If you develop that foundation in your life, that being gratitude towards your parents or to your college or to your institution, that at least I have this. During COVID time, many people have lost their jobs. They're on streets. At least you have a job, you have a salary. Maybe it's a bit less or 50% they have given, whatever it is. At least you're still more safer than many people who have lost their life due to COVID, isn't it? Globally, lakhs and people lost their life, isn't it? So at least you're alive and you're walking, you're moving, you're talking. So first be thankful about it. It doesn't mean that you need to be complacent. Okay, I need to be happy about everything. It's not like that. First, that is a foundation. And if you're unhappy about any of your academic success in life, work upon it. Why there isn't an academic success? Why I'm unable to do my PhD or MPhil? What are the troubles? What are the difficulties? Why I'm not get why I should not ask my seniors or guides to help me or track me? How can I self learn myself? All these things is all about self improvisation. As a doctors, even after finishing our post graduation and all, we still attend conferences, try to keep in track with the latest technology and whatever is happening, because it's a lifelong process. I know I will not say that I have done my MRCP from London and everything, I've studied too much, I don't want to study anymore. No, that doesn't work like that, because we never knew about COVID-19 1.5 years ago, isn't it? So it's all came as a surprise to us, and we need to learn about it, and we need to be geared up about future pandemics as well. Any other question? All right. Thank you so much for patient listening. I think it will be more useful if I do a more live and interactive session with the webinar and without slides. I think I have done justice to what I have intended to do. And if you have any doubts or anything, so please feel free to contact me. I'm always available in my Positive Mind Hospital at Shivamogga. Thank you so much. All the best to you.
Certainly, sir, you have done the justice on the topic. So I thank Dr. Aravind sir for catering his resourcefulness on stress management topic for all our FTP participants. And this was really a much needed session in this pandemic situation. And I really thank Dr. Aravind sir for throwing light on stress management and how to deal with all anxiety related sort of problems. Having said this, now let's call it a day, and let's assemble back tomorrow, and we'll have session by Dr. Kiran sir from NITK Surathkal at sharp 9:30 a.m. Thank you, one and all.
Thank you so much. Thank you.
Dear participants, feedback link for this session will be posted in the WhatsApp, and please give your valuable feedback. Thank you. So Mohit Beniwal sir, feedback link will be posted at exactly 4 p.m. So wait for the feedback link in the WhatsApp. Thank you.